Hi, welcome to a look at the report Impact of Non-Pharmaceutical Interventions to Reduce COVID-19 Mortality and Healthcare Demand from the Imperial College COVID-19 Response Team. So this video will be a bit different from the usual fare on this channel. We'll be looking at the report entitled Impact of Non-Pharmaceutical Interventions to Reduce COVID-19 Mortality and Healthcare Demand from the Imperial College COVID-19 Response Team. A link to the paper is given in the video description below. This report was released on March 16, 2020. It gives the results of epidemiological modeling for the case of COVID-19. This report has been important in the decisions governments have made regarding attempts to slow the spread of COVID-19. The modeling studies in this report look at the use of non-pharmaceutical interventions, or NPIs, in reducing the rate of transmission. These NPIs include things like social distancing, home quarantine, and school and university closure. They consider mitigation and suppression strategies in Great Britain and the US. The main reason why we're covering it here is because the topic of this paper is clearly of relevance to an extremely large number of people. But on a secondary note, some viewers of this channel with interests in data science and modeling may be interested in the methods and considerations that went into this paper. So here we should pause to make an important point. I'm a physicist, not a medical doctor or an epidemiologist. My goal here is to draw your attention to this report and give a brief summary. My intention is not to make any judgments about its assumptions or its methods, for the simple reason that I'm not qualified to do so. Because I'm just giving a summary, I won't be going through all of the details. I encourage you to take a look at the report for yourself and also to try to find other primary sources as well. Now, clearly, the situation with COVID-19 is fast changing. This paper presents the output of models which rely on assumptions. It is reasonable to expect that those assumptions will have to be modified as new information comes in. I'm posting this video on April 2nd, 2020. If you're watching it long after that, the content may well be out of date. If this video becomes sufficiently out of date that it requires an update, I will give a link here in the upper right corner as well as in the video description below. Okay, so let's start with some of the terms used in the report. So first of all, NPI. This stands for non-pharmaceutical interventions. These are public health measures which are intended to reduce transmission of the virus by reducing contact rates in the population. They include things like social distancing and school closures. Next, R0. This is called the basic reproduction number. This is the average number of people that will become infected by an infected individual if the entire population is susceptible and no measures are adopted to prevent transmission. Okay, next, R. This is the effective reproduction number. This is the average number of people that will become infected by an infected individual in the actual state of the population. So R can differ from R0 if some people have immunity or if measures are adopted to prevent transmission from one person to another. The disease spreads if R is greater than 1 and dies off if R is less than 1. And finally, let's look at the terms they use for their different strategies. So the first strategy is suppression. Here, the goal is to reduce R to be less than 1. A suppression strategy needs to continue, at least intermittently, as long as the virus circulates and there is no effective vaccine. The other strategy is mitigation. So in this case, the goal is to reduce R, but not have R less than 1. The idea is to slow the spread and reduce the health impact, and eventually herd immunity will develop. Okay, next let's look at some of the things that they considered in their modeling. First, they only look at the effects of these strategies on the direct health impact of the COVID-19 epidemic. They don't consider, for example, the economic effect of these strategies or the long-term effects of suppression strategies. And they also don't include non-mandated behavior changes in the population. Okay, so first, they look at contacts between people. So they look at contacts between individuals at home, in school, at work, and in the community in general. To do this, they took into account information like population density data, age, household size, class sizes, and workplace size. Next, they looked at details of how the infection spreads from person to person. So they look at the case R0 equals 2.4, but they also consider values of R0 from 2.0 to 2.6. They assumed an incubation period of 5.1 days, and they considered both symptomatic and asymptomatic individuals. They took infectiousness to vary from person to person and to vary with time for a given person. Symptomatic individuals were taken as 50% more infectious than asymptomatic. They assumed the infection was seeded at an exponentially growing rate in each country, so that's Great Britain and the US, starting from early January 2020. And they also assumed that recovered individuals would have short-term immunity. Okay, they also made assumptions about symptoms, hospitalization, and fatality rates. They assume that 2/3 of cases have symptoms sufficiently identifiable to self-isolate by 1 day after symptoms arise. They assumed hospitalization, if needed, would happen on average 5 days after symptoms arise. Data from China were adjusted for the age distribution to get hospitalization and fatality rates. It is assumed that 30% of those hospitalized will need critical care. They assume 50% of those in critical care and an age-dependent fraction of those not in critical care will die. And they assume 8 days in the hospital for those not requiring critical care, and 16 days, 10 of which are in the ICU, for those who do. Next, let's look at the NPIs that they considered. First, there are 2 NPIs that are assumed to take effect on an individual level the day after symptoms arise. So the first of these is case isolation. Here, people with symptoms stay home for 7 days. The second of these is voluntary home quarantine. Here, all household members remain at home for 14 days after the symptomatic case is identified. Next, there are 3 NPIs that would be instituted at a governmental level. These 3 are the following: social distancing of those over age 70, social distancing of the entire population, and school and university closure. For these NPIs, they make assumptions about how contacts between individuals would change and about rates of compliance. For example, for the case of social distancing of those over age 70, they assume that those affected would reduce work contacts by 50%, increase household contacts by 25%, and reduce other contacts by 75%. And they assume 75% compliance. Also, they say that they try to make assumptions which are pessimistic. Okay, next they look at various scenarios. First, they consider the unmitigated case, where no action is taken against the epidemic. Next, they look at mitigation scenarios. Then they consider suppression scenarios. And lastly, they look at an adaptive policy of suppression strategies. Okay, so first let's look at the unmitigated scenario. If no actions are taken and there are no other changes in behavior, they predict that the number of deaths per day would peak after about 3 months. For R0 equal to 2.4, they predict that 81% of the populations in Great Britain and the US would become infected. The total predicted number of deaths in Great Britain is 510,000, and that in the US is 2.2 million. They predict that the peak need for ICU or critical care would be greater than 30 times the supply. Okay, next they consider mitigated scenarios. In these cases, the goal is to flatten the curve, but not to drop R to be less than 1. They look at NPIs applied nationally for 3 months, except for social distancing of those over 70, which is applied for 4 months. They take the trigger for implementation of the NPIs to be the number of critical care cases. They consider different values for the trigger. They find that the best combination, given the above stipulations, is case isolation, home quarantine, and social distancing of those over 70. This scenario reduces the number of deaths by half and reduces peak critical care demand by 2/3 compared to the unmitigated scenario. But it still leads to a peak demand for critical care beds that are 8 times higher than capacity. Additionally, if mitigation strategies are introduced too early, it is possible that too little herd immunity will have developed and the epidemic will simply return when the NPIs are lifted. Okay, next the report looked at suppression strategies. Here the goal is to reduce R to be less than 1. They assume that measures are put into place for 5 months. They find that simultaneous use of A, case isolation, B, social distancing of the entire population, and C, household quarantine and/or school and university closure would keep critical care bed requirements below or near capacity while these measures were in place. However, after the measures are lifted, cases return, resulting in an epidemic later in the year. Strong suppression while the measures are in place results in a large peak once measures are lifted, as herd immunity is less developed. So the authors looked at adaptive strategies over a 2-year span. In their adaptive strategies, they considered case isolation and social distancing, possibly combined with school and university closure and/or household quarantine. they considered a 2-year time span. Case isolation and, if used, household quarantine are used throughout the 2 years. Social distancing and, if used, school and university closure are turned on and off according to triggers that depend on the number of ICU cases. Their model predicts that an adaptive policy utilizing case isolation, social distancing, and school and university closure can greatly reduce the number of deaths and keep the peak ICU bed demand under or near capacity. Social distancing and school and university closure would still have to be enforced for most, but not all of the time, until a vaccine became available. Okay, so let's briefly summarize. Here we've taken a look at a report from the Imperial College COVID-19 response team that looks at non-pharmaceutical interventions and their effects on the number of deaths and peak critical care bed demand brought about by the COVID-19 pandemic. This report has played a role in the decisions of governments trying to combat the virus. I'd encourage you to take a look at this paper as well as other primary sources.